She's a communication advisor of the Norwegian Refugee Council. She joins me live from occupied East Jerusalem. And I'd like to continue the conversation from what we just heard from our correspondent. He says that people are starving in Gaza. And also there's an accusation that this is deliberate and that Israel is weaponizing the restriction of aid to starve people deliberately in Gaza. The UN is saying that the consequence of all this is that they anticipate there's going to be a spike in child deaths because of a lack of food and also because of the spread of disease. They go hand in hand. My question to you is, from your experience, because no one can really imagine what it's like, when a parent has a child who is starving, what lengths will they go to? How do people normally behave in these situations?
I think parents are just trying to do whatever they can to feed their families, and the level of desperation throughout all of Gaza, but particularly in north of Gaza, is certainly leading to a deterioration of law and order as people become more and more desperate, as aid supplies dwindle. It's inevitable that there's going to be chaos, looting, charging of aid trucks. By no means do I condone that behavior, but it certainly is understandable.
Shaina, history tells us that that's how people behave. So the obvious question is that what Israel intends to happen?
Well, I think with the reports we saw last week of efforts to prevent UNRWA's flour from entering Gaza, we've seen Israeli civilians protesting outside of the Kerem Shalom crossing, preventing aid from getting in. And hampering aid efforts. It certainly seems that way, that Israel is using starvation as a weapon of war. It's important to remember, of course, that around 50% of Gaza's population are children under the age of 18. And of course, as UNICEF drew attention to, the youngest children are the most vulnerable here.
According to that report about the number of children who are going to die, it's just a fact according to the UN. They're going to die because of a lack of food, because of disease. For the ones who are fortunate enough to survive, what kind of future do you see them having? Because psychologically, I don't see how they can't be massively traumatized. What chance do they have of growing up mentally healthy?
You know, it's really challenging. Even prior to October 7th, Palestinian and children had faced multiple escalations and hostilities leading to trauma. We at the Norwegian Refugee Council were working in schools, helping to make children more resilient, overcome their trauma, be successful as students. But it's really unimaginable how we can continue to do this type of programming when children are continuing to be traumatized on a daily basis. It's the lasting impact is not just in the coming months, but this is years, this is generations of Palestinians who are traumatized and will be traumatized and will certainly impact Palestinian identity moving forward. We know that already from seeing the survivors of the Nakba who continue to face the trauma and are in fact triggered by what they're seeing in Gaza today, that this is a lasting impact that is going to impact Palestinian society many, many generations into the future.
Obviously, politically, no one's been able to do anything to stop this conflict so far. But if I ask you on a humanitarian level, with Israel stopping aid coming in, can you see any solution to the suffering? What would you like to see done, if anything?
Well, of course, the first thing that needs to be done is a ceasefire. As Nizar said, this conflict is only going to be solved through political means, not through military might. And so we first and foremost need the parties to agree to a ceasefire, and we need to allow for the massive scaling up of humanitarian aid. We need aid workers to be guaranteed of their safety when they're bringing in aid and distributing it, and we need aid workers to be able to reach all areas of Gaza and to be able to do that safely. Otherwise, people are going to continue to suffer, and there won't be a resolution in sight.
Shaina, thank you so much. Good to speak to you. Shaina Low, Communication Advisor of the Norwegian Refugee Council, my guest.